A little while ago, I was approached by a good friend of mine, Tom. We go way back, and he feels that as he's getting older, he's been developing some wrinkles that he isn't all that happy with, and he was wondering whether maybe there is any kind of treatment that I could do for him. He already kind of suggested Botox. By the end of this video, you will know a lot more about what Botox could possibly do for you. I've been an anti-aging physician for the past 26 years, offering various anti-aging treatments, and we decided to shoot Tom's treatment to kind of give you an idea as to what a Botox treatment is about through Tom's eyes. I told Tom, and I tell this all my patients, that he shouldn't expect to walk out of my office with a smooth face, because it takes basically somewhere between 3 to 5 days before the botulinum toxin actually takes effect. So it's not like you get your little shots and then you walk out with a smooth face. Absolutely not. What does make sense is to kind of, after maybe 10 days, give or take, to come back into the office to reevaluate the results, because some people will need a tiny little bit of a touch-up. So you should, if you think you need a touch-up, do not go see your doctor until 10 days after the treatment, because that's when the treatment will have actually kind of settled. Another thing I want to point out is that if you're going to get another treatment, that you get it, give or take, within 14 days after the initial treatment. The thing is that if you wait too long, then the chances are that by getting another injection, you will actually develop antibodies against the Botox, and you will become desensitized, and the Botox will never ever work again. And so either you get your treatment within 14 days after the initial one, or you need to wait for at least 3 months. So depending on what doctor you go to, make sure that, if you feel that after 2 months some of your wrinkles come back, and you go to your Botox doctor and say you would like another treatment, make sure that the doctor knows when your last treatment was, because otherwise you're basically shooting yourself in the foot. Although most people do a botulinum toxin treatment purely for kind of luxury reasons, because they want to look good, there are actually conditions, medical conditions, that warrant a Botox treatment as well. For instance, people who suffer from grinding of their teeth. Usually that happens while you're asleep. You're moving your teeth around, you're basically honing your teeth, and by injecting a tiny little bit of botulinum toxin in the cheek muscle here, you relax the muscle, and that's a way to basically save your teeth. Another reason to do a botulinum toxin treatment is in people who suffer from very, very exaggerated, heavy perspiration. You can give them a number of tiny little injections in their armpits that basically stops you from sweating so much. And there are certain neurological conditions such as torticollis, people who have a really huge cramp in their neck muscle that forces their head into a direction that they don't want to be in, and by injecting a couple of tiny little injections, it relaxes the muscle and they can freely move their head. So botulinum toxin, mostly luxury treatment, but not in every case.